Sudhir Warrier. I have no financial disclosures relevant to this talk. I'd like to start with the case of one of my senior orthopedic colleagues who had bilateral CMC joint arthritis, which I had operated 9 years ago on one side and 11 years ago on the other side. These are his present x-rays and they look wonderful, just as his hand is, with no pain. He's a prolific orthopedic surgeon and continues to enjoy freedom of movement in all planes. Well, having shown you that case, it's still very rare for us to operate CMC joint arthritis in my country. And why is that so? Well, some of the reasons I think lie here, that India is a very populous country, and a large proportion of this population lives in rural areas, and only 28% of the patients have public health care. It means we're not seeing many of them. There may be so much more of arthritis all around, but we aren't seeing all of them. Add to that only 17% of Indians have health insurance, and that private healthcare is 4 times costlier at least. That means we're not seeing all of them again. But that's on the mend, fortunately for us, that the Prime Minister and the National Health Authority have reached out to a large number, 50 crore citizens, offering healthcare up to £5,000 annually per family. So things are on the mend, and maybe we'll see some more as times go by. Add to this that the milder stages of CMC arthritis are compatible with fair functional use of the hand. Acute exacerbations are at times followed by symptom-free intervals, so they feel much better when they take alternate treatments. Radiological changes do not reflect the actual clinical situation. That's very, very clear from our practice. Well, let's look at my practice. My practice is that of a private practitioner. I see 10 to 12 new patients a day, 6 days a week, before the pandemic, that is. Approximately around 2,500 new patients a year. I see 3 to 5 patients with varying degrees of basal thumb joint arthritis every month. It is a tertiary referral practice, and therefore only the most severe grades probably end up coming to see me. When I look back over the last 10 years, I find I haven't operated more than 7 cases in a year. Most of the times it's under 4 cases a year. And I keep wondering, why am I doing so few? So I asked a friend, Dr. Anil Bhatt, who was a professor at a prominent university hospital here. And he looked up his records, and in 2019, he said they had done 11 surgeries and seen only 60 cases in their outpatient department of CMC joint arthritis of the thumb. And that's the list of surgeries that they did. I also then spoke to Professor Binu Thomas at CMC Vellore, and he said they had similar numbers in that hospital too. So are we more pain tolerant, or are we averse to surgical treatments in general? Or is it that we have a secret and we aren't telling you? Well, the Ayurvedic influence is there. So we have various forms of alternate therapies, which does have some effect in alleviating pain and swelling and allows patients to use their hands. Add to this that there are lots of studies that talk about the anatomical variations in the insertions of the tendons around the thumb. And there are many publications, including Bhatia and Oberla's publication, that talks about 70% of dissections having an abductor pollicis longus slip in the trapezium, as also from the other studies, including Marco Rizzo's study that talks about 90%. Well, the Indian studies reflect around 42% only. That's about half having that extra slip of the abductor attached to the trapezium. Does that have an effect on the severity of the disease? Well, we don't know. And is that slip causing rapid progression or more symptomatic arthritis in the Western thumb? Something that we need to look at. What about age and the disease? And this is a paper from Jesse Jupiter and David Ring, where they have shown that arthritis increases as age increases. The number of women affected are almost twice that. So when you're about 80, almost 90% of the patients, women have it. And when it reaches above 80, it's about 100% of the women having this arthritis. What does that have to do with this? Well, in the United Kingdom, your life expectancy is 81 years. In India, that is 69. We live 12 years lesser than you do. And as you see, Jupiter's paper talking about larger numbers being seen at older ages, we're not reaching there probably. We have only 8.9% of the population above the age of 60, while UK has 22%. That's 3 times almost. So you have a larger group of older people who can suffer from this disease, and we are seeing lesser of that. A lot of our population lives in the rural areas, and the family structures there are very different than urban India. This is my father's family in 1960. Much of this family lives together with their offsprings and their children, and 3 to 4 generations cohabiting. Help is always around. Well, help, even in urban areas, is always around and quite cheap to get. In the rural areas, it would cost about £40 a month to about £300 a month in urban areas to have someone attend to you for 24 hours. The official retirement age is 60 years in India, which means you're relieved from physically demanding jobs, rigors of travel, etc. And all you need to do then is to firmly mix chewable tobacco in your palms, and that's where the thumb is used maximally. This is one of my patients in a place where I do pro bono work, and she has prominent CMC joint arthritis, but she's quite happy doing all her activities without too much discomfort, with a smile on her face. So senior citizens in India do not need to drive, don't need to cook sometimes, don't need to play tennis or golf regularly, and there's no physically demanding avocations. They follow their religious pursuits, rock in their easy chairs, and play with their grandchildren, many of whom are in your country. The smaller the family size, the lesser the help, and you need to be independent. So you are seeing more older people, more demanding people, more people living independently and living for much longer and having access to standardized medical care. And many choose not to suffer any pain. Well, our patients, we do have a large number of patients, and who we don't know whether radiology is the key to all of this and whether we can standardize indications for procedures. Apart from excising the trapezium, we also tend to fuse some of them while we await the long-term results of arthroplasties. But until then, we operate fewer patients of basal joint arthritis of the thumb. Thank you very much for your attention.